Which organization is responsible for regulating the practice of pharmacy in the United States? A. D. B. FDA. C. NABP. D. AMA. The correct answer is C. The National Association of Boards of Pharmacy, or NABP, is responsible for regulating the practice of pharmacy in the United States. What is the purpose of the HIPAA privacy rule in pharmacy practice? A. To ensure that pharmacists provide free medications to patients. B. To protect the privacy and security of patients' health information. C. To regulate the sale of over-the-counter medications. D. To require pharmacists to wear face masks at all times. The correct answer is B. The HIPAA privacy rule protects the privacy and security of patient health information in pharmacy practice. Which of the following is an example of a controlled substance according to the D? A. Aspirin. B. Ibuprofen. C. Oxycodone. D. Benadryl. The correct answer is C. Oxycodone is an example of a controlled substance regulated by the D. What is the purpose of the Poison Prevention Packaging Act in pharmacy practice? A. To regulate the sale of vitamins and supplements. B. To ensure that all medications are dispensed in child-resistant containers. C. To require pharmacists to wear gloves when handling medications. D. To limit the number of medications a patient can receive at once. The correct answer is B. The Poison Prevention Packaging Act ensures that medications are dispensed in child-resistant containers to prevent accidental ingestion. What does the term standard of care refer to in pharmacy practice? A. The minimum level of care that must be provided to patients. B. The maximum level of care that can be provided to patients. C. The use of experimental drugs without patient consent. D. The process of compounding medications in a pharmacy. The correct answer is A. The standard of care refers to the minimum level of care that must be provided to patients in pharmacy practice. What is the role of the Board of Pharmacy in pharmacy regulation? A. To set the price of prescription medications. B. To oversee the licensing and regulation of pharmacists and pharmacies. C. To promote the use of generic medications over brand name drugs. D. To provide medical advice to patients. The correct answer is B. The Board of Pharmacy oversees the licensing and regulation of pharmacists and pharmacies to ensure patient safety. What is the purpose of the FDA in pharmacy regulation? A. To enforce pharmacy ethics guidelines. B. To regulate the manufacturing and distribution of medications. C. To provide medical training to pharmacy students. D. To oversee the licensing of pharmacists. The correct answer is B. The FDA regulates the manufacturing and distribution of medications to ensure their safety and efficacy in pharmacy practice. What does the Ryan-Haight Online Pharmacy Consumer Protection Act regulate? A. The storage of medications in a pharmacy. B. The sale of medications online without a valid prescription. C. The advertising of pharmacies on social media. D. The labeling of over-the-counter medications. The correct answer is B. The Ryan-Haight Online Pharmacy Consumer Protection Act regulates the sale of medications online to prevent the illegal sale of prescription drugs without a valid prescription. What is the purpose of the Drug Enforcement Administration, or D, in pharmacy regulation? A. Ensure safe and effective use of medications. B. Prevent drug abuse and diversion. C. Regulate pharmacy billing practices. D. Provide medication counseling services. The correct answer is B. The D is responsible for enforcing controlled substances laws and regulations in the United States to prevent drug abuse and diversion. What is the significance of the Ryan-Haight Online Pharmacy Consumer Protection Act in pharmacy practice? A. Regulating compounding pharmacies. B. Ensuring safe medication dispensing in online pharmacies. C. Regulating controlled substance prescriptions online. D. Setting guidelines for pharmacy marketing practices. The correct answer is C. The Ryan-Haight Act addresses the sale of controlled substances over the internet and aims to prevent illegal online prescription drug sales. Which of the following is an example of a breach of patient confidentiality in pharmacy practice? A. Discussing a patient's medication therapy with a healthcare provider. B. Sharing patient information on social media. C. Entering patient information correctly into the pharmacy system. D. Communicating medication side effects with the patient. The correct answer is B. Sharing patient information on social media violates patient confidentiality and is unethical. What is the purpose of the Whistleblower Protection Act in pharmacy ethics? A. Promote honesty and integrity in pharmacy practice. B. Protect pharmacists from retaliation for reporting violations. C. Regulate medication dispensing procedures. D. Facilitate communication between healthcare providers. The correct answer is B. The Whistleblower Protection Act aims to protect pharmacists from retaliation for reporting violations or unethical behavior in the workplace. What does the term conflict of interest refer to in pharmacy ethics? A. Providing medication counseling services to patients. B. Accepting gifts from pharmaceutical companies as a pharmacist. C. Adhering to patient confidentiality guidelines. D. Collaborating with healthcare providers on patient care. The correct answer is B. A conflict of interest occurs when a pharmacist's personal interests may interfere with their professional judgment or duties, such as accepting gifts from pharmaceutical companies. Which of the following is an example of a pharmacy technician exceeding their scope of practice? A. Assisting the pharmacist in medication dispensing tasks. B. Providing medication counseling to patients under the pharmacist's supervision. C. Independently adjusting medication dosages for patients. D. Performing drug utilization review for prescription orders. The correct answer is C. Independently adjusting medication dosages for patients is typically outside the scope of practice for pharmacy technicians and should be done by a licensed pharmacist. What is the purpose of the HIPAA security rule in pharmacy practice? A. Ensuring patient information confidentiality and security. B. Regulating pharmacy inventory management. C. Setting guidelines for medication compounding. D. Monitoring controlled substance prescriptions. The correct answer is A. The HIPAA security rule aims to ensure the confidentiality, integrity, and availability of electronic protected health information, or EPHI, in pharmacy practice. What is a pharmacist's role in preventing medication errors? A. Verifying prescription accuracy. B. Educating patients on medication adherence. C. Collaborating with healthcare providers on treatment plans. D. Checking for drug interactions and allergies before dispensing medications. The correct answer is D. One of the pharmacist's responsibilities is to check for potential drug interactions and patient allergies before dispensing medications to prevent errors. Why is it important for pharmacists to practice within the scope of their professional competence? A. To increase pharmacy revenue. B. To maintain patient trust and safety. C. To promote medication compounding services. D. To provide discounts on medications. The correct answer is B. Practicing within their professional competence helps pharmacists maintain patient trust, safety, and the quality of care provided. Which of the following is an example of a pharmacy technician violating patient confidentiality? A. Discussing a patient's medication history with a friend. B. Providing medication information to a patient's healthcare provider. C. Following proper procedures when disposing of patient records. D. Documenting medication errors accurately in patient records. The correct answer is A. The discussion of a patient's medication history with a friend violates patient confidentiality and is a breach of ethics. What does the term fiduciary duty mean in the context of pharmacy ethics? A. Ensuring patient information is kept secure. B. Acting in the best interest of patients. C. Maintaining accurate medication records. D. Collaborating with healthcare providers. The correct answer is B. Fiduciary duty in pharmacy ethics refers to the obligation to act in the best interest of patients. What is the role of the United States Pharmacopoeia, or USP, in pharmacy practice? A. Regulating controlled substances. B. Setting quality standards for medications. C. Enforcing pharmacy laws. D. Accrediting pharmacist training programs. The correct answer is B. The USP establishes quality standards for medications to ensure safety and efficacy. Which of the following is an example of a pharmacist practicing within their scope of practice? A. Diagnosing medical conditions. B. Counseling patients on medication use. C. Performing surgical procedures. D. Ordering laboratory tests. The correct answer is B. Counseling patients on medication use falls within the scope of practice for pharmacists and is a standard responsibility. What is the purpose of the anti-kickback statute in pharmacy regulation? A. Preventing financial incentives for healthcare referrals. B. Regulating controlled substance prescriptions. C. Enforcing medication labeling requirements. D. Restricting pharmacist employment contracts. The correct answer is A. The anti-kickback statute aims to prevent financial incentivization for healthcare referrals, which can compromise patient care. What is a pharmacy technician's role in keeping medications safe? A. Administering vaccinations to patients. B. Performing medication reconciliation. C. Participating in medication therapy management. D. Following proper labeling and storage procedures. The correct answer is D. One responsibility of pharmacy technicians is to ensure medication safety through proper labeling and storage procedures. What is the significance of the Drug Quality and Security Act in pharmacy practice? A. Regulating compounding pharmacies. B. Setting quality standards for drug manufacturing. C. Enhancing drug supply chain security. D. Enforcing medication dispensing guidelines. The correct answer is C. The Drug Quality and Security Act aims to improve drug supply chain security to protect patients from counterfeit medications. Which of the following is an example of a breach of pharmacy law in dispensing controlled substances? A. Documenting drug interactions in patient records. B. Verifying prescription authenticity before dispensing. C. Diverting controlled substances for personal use. D. Maintaining accurate medication inventory records. The correct answer is C. Diverting controlled substances for personal use is a violation of pharmacy law and ethical standards. What is the role of the Centers for Medicare and Medicaid Services, or CMS, in pharmacy regulation? A. Overseeing drug enforcement efforts. B. Administering pharmacy licensing exams. C. Regulating reimbursement for pharmacy services. D. Accrediting pharmacy continuing education programs. The correct answer is C. CMS plays a role in regulating reimbursement for pharmacy services, particularly through Medicare and Medicaid programs. Why is it important for pharmacists to get informed consent from patients before providing certain services? A. To increase pharmacy revenue. B. To ensure patient autonomy and decision making. C. To expedite medication dispensing processes. D. To meet healthcare provider requirements. The correct answer is B. Obtaining informed consent from patients ensures respect for patient autonomy and allows individuals to make decisions about their healthcare. How does the Ryan-Haight Online Pharmacy Consumer Protection Act impact online pharmacy services? A. Allows unrestricted online sales of prescription drugs. B. Requires a valid prescription for online prescription drug sales. C. Bans online pharmacies from operating. D. Limits the types of medications sold online. The correct answer is B. The Ryan-Haight Act regulates online pharmacy sales by requiring a valid prescription for prescription drugs. What is a pharmacy technician's responsibility regarding patient confidentiality? A. Sharing patient information with colleagues. B. Keeping patient information confidential. C. Discussing patient conditions in public areas. D. Posting patient information on social media. The correct answer is B. Pharmacy technicians must keep patient information confidential to ensure patient privacy and trust. What is the significance of the anti-kickback statute in pharmacy law? A. Allows pharmacists to accept kickbacks from pharmaceutical companies. B. Prohibits pharmacists from engaging in patient counseling services. C. Prevents pharmacists from offering or receiving kickbacks for referrals. D. Limits pharmacists from participating in professional organizations. The correct answer is C. The anti-kickback statute prohibits pharmacists from offering or receiving kickbacks for referrals, ensuring fair and ethical practices. Why is it essential for pharmacists to practice within the scope of their professional competence? A. To avoid consulting with healthcare providers. B. To increase revenue for the pharmacy. C. To ensure safe and effective patient care. D. To decrease patient consultations. The correct answer is C. Practicing within their professional competence helps pharmacists provide safe and effective care to patients. What is the purpose of the Drug Quality and Security Act in pharmacy practice? A. Ensures medications are not available to patients. B. Requires pharmacists to dispense expired medications. C. Improves drug safety and tracking in the supply chain. D. Restricts the availability of generic medications. The correct answer is C. The Drug Quality and Security Act enhances drug safety and tracking in the pharmaceutical supply chain. Which of the following would be considered a breach of patient confidentiality in pharmacy practice? A. Requesting patient consent before sharing information. B. Discussing patient information in a private consultation room. C. Sharing patient information without authorization. D. Documenting patient interactions in the pharmacy system. The correct answer is C. Sharing patient information without authorization breaches patient confidentiality and violates ethical standards. What is a pharmacist's responsibility when dispensing controlled substances, following pharmacy laws? A. Dispensing controlled substances without verification. Less than B or greater than. B. Accurately recording controlled substance dispensing. Less than B or greater than. C. Failing to follow prescription requirements for controlled substances. Less than B or greater than. D. Ignoring patient counseling for controlled substances. The correct answer is B. Pharmacists must document and dispense controlled substances accurately to comply with pharmacy laws. What is the role of the Centers for Medicare and Medicaid Services, or CMS, in pharmacy regulation? A. Enforcing pharmacy state regulations. B. Overseeing billing practices for pharmaceutical services. C. Regulating controlled substances. D. Establishing pharmacy guidelines for ethics. The correct answer is B. The CMS oversees billing practices related to pharmacy services within the Medicare and Medicaid programs. Why is getting informed consent from patients important for pharmacists before giving certain services? A. To increase patient costs for services. B. To ensure patients understand and agree to treatment. C. To avoid consulting with healthcare providers. D. To speed up the dispensing process. The correct answer is B. Obtaining informed consent ensures patients understand and agree to the treatment or services provided by the pharmacist. What is the purpose of the Drug Enforcement Administration, or D, in pharmacy regulation? A. To regulate controlled substances. B. To oversee pharmacy technicians. C. To manage pharmacy inventory. D. To conduct pharmacy inspections. The correct answer is A. The D regulates controlled substances to prevent abuse and ensure pharmacy safety. What does the anti-kickback statute regulate in pharmacy law? A. Prescription drug pricing. B. Pharmacist licensure. C. Inducements for referrals. D. Pharmacy advertising. The correct answer is C. The anti-kickback statute prohibits inducements for healthcare referrals, including pharmacy services. This prevents financial incentives from affecting patient care decisions. Why is it important for pharmacists to practice within the scope of their professional competence? A. To increase prescription sales. B. To improve patient outcomes. C. To avoid pharmacy inspections. D. To reduce medication costs. The correct answer is B. Pharmacists need to practice within their professional competence to ensure safe and effective patient care, and to improve health outcomes. What is the role of the United States Pharmacopoeia, or USP, in pharmacy practice? A. Regulating pharmacy licensing. B. Setting quality standards for medicines. C. Enforcing pharmacy ethics. D. Training pharmacy technicians. The correct answer is B. The USP sets quality standards for medicines to ensure consistency, safety, and efficacy in pharmacy practice. Which of the following is an example of a pharmacy technician exceeding their scope of practice? A. Assisting pharmacists with medication dispensing. B. Providing medication counseling to patients. C. Diagnosing medical conditions. D. Performing final checks on compounded medications. The correct answer is C. Diagnosing medical conditions is outside the scope of practice for pharmacy technicians. It requires medical expertise and licensure. What is a pharmacist's role in preventing medication errors? A. Increasing prescription fill rates. B. Educating patients on medication storage. C. Collaborating with pharmaceutical companies. D. Implementing quality assurance processes. The correct answer is D. Pharmacists are responsible for implementing quality assurance processes to prevent medication errors and ensure patient safety. What is the purpose of the Whistleblower Protection Act in pharmacy ethics? A. To protect pharmacy employees from retaliation for reporting violations. B. To regulate prescription drug pricing. C. To enforce pharmacy advertising guidelines. D. To ensure pharmacy inventory control. The correct answer is A. The Whistleblower Protection Act protects pharmacy employees who report violations or unethical behavior from workplace retaliation. What is the significance of the Poison Prevention Packaging Act in pharmacy practice? A. Regulating drug manufacturing processes. B. Preventing accidental medication ingestion. C. Controlling pharmacy staff licensure. D. Monitoring pharmacy inventory levels. The correct answer is B. The Poison Prevention Packaging Act aims to prevent accidental medication ingestion, especially by children, through child-resistant packaging in pharmacies. What does the term fiduciary duty mean in the context of pharmacy ethics? A. Prioritizing profitability over patient care. B. Acting in the best interest of the patient. C. Disclosing patient information to third parties. D. Accepting inducements for referrals. The correct answer is B. Fiduciary duty in pharmacy ethics means pharmacists always put their patients first, prioritizing care and well-being above everything else. What is the role of the National Association of Boards of Pharmacy, or NABP, in regulating pharmacy practice? A. Setting medication pricing guidelines. B. Overseeing pharmacy accreditation processes. C. Establishing pharmacy technician training requirements. D. Providing pharmacist licensure exams. The correct answer is B. The NABP helps oversee pharmacy accreditation, making sure pharmacies meet national quality and safety standards. What is the primary purpose of the Ryan-Haight Online Pharmacy Consumer Protection Act in pharmacy practice? A. To regulate the sale of prescription drugs online. B. To enforce proper labeling of over-the-counter medications. C. To oversee the licensing of pharmacy technicians. D. To establish guidelines for compounding pharmacies. The correct answer is A. The Ryan-Haight Act regulates the sale of controlled substances online to protect consumers from potential risks associated with online pharmacies. Which of the following scenarios is a breach of pharmacy ethics? A. A pharmacist disclosing patient information to a third party for marketing purposes. B. A pharmacy technician checking prescription accuracy twice before dispensing. C. A pharmacy keeping up-to-date records of controlled substance dispensing. D. A pharmacist providing a patient with proper medication counseling. The correct answer is A. Disclosing patient information for non-treatment purposes without consent violates patient confidentiality and ethical standards. What is the primary role of the Board of Pharmacy in pharmacy regulation? A. To provide continuing education for pharmacists. B. To issue pharmacy licenses and oversee pharmacy practice. C. To regulate the pricing of prescription medications. D. To monitor patient outcomes after medication dispensing. The correct answer is B. The Board of Pharmacy is responsible for issuing licenses and regulating pharmacy practice to ensure public safety and compliance with laws and regulations. Why is it important for pharmacists to follow the standard of care in pharmacy practice? A. To set competitive pricing for prescription medications. B. To establish guidelines for compounding medications. C. To ensure consistent quality of service and patient care. D. To determine the appropriate number of pharmacy staff per shift. The correct answer is C. The standard of care in pharmacy practice refers to providing the level of care and service that a reasonable pharmacist would offer under similar circumstances, ensuring consistent quality and patient safety. Which of the following is an example of a violation of pharmacy law regarding dispensing controlled substances? A. A pharmacist verifying a prescription with the prescribing physician. B. A pharmacy technician accurately counting medication tablets before dispensing. C. A pharmacy storing controlled substances securely in a locked cabinet. D. A pharmacist dispensing controlled substances without a valid prescription. The correct answer is D. Dispensing controlled substances without a valid prescription is illegal and a violation of pharmacy laws and regulations.